All right. So I tell you what, we're going to get started here on cholinesterase inhibitors. And our prototype for this is Aricept, also called donepezil. The pharmacodynamics associated with this is that it is used therapeutically to improve cognitive function in those with Alzheimer's. So it is also thought to slow the progression slightly. Not a lot, but slightly. As far as how it works biochemically, cholinesterase inhibitors do prevent the enzyme acetylcholinesterase from inactivating acetylcholine. So this just means that acetylcholine is more available to work. So it is kind of like just saying a cholinergic. And so there's more acetylcholine available at receptor sites in the brain. All right, so cholinesterase inhibitors like Aricept, especially Aricept donepezil, adverse effects include CNS effects. So we want to be assessing patients for their cognitive function, but they usually do overall cognitive functions in a test format at the doctor's office, actually. But we can do cognitive assessments with them. And some facilities actually do have cognitive assessments to see the progression and if it actually is improving cognitive function. So assessing prior to giving donepezil, since bradycardia is an adverse effect, we want to make sure we're monitoring that heart rate regularly. We really don't want that heart rate to get below 60. They can have syncope, which is this loss of consciousness, which is dangerous because they can fall and hit their head, right? So we want to monitor heart rate regularly. So that's part of the assessment prior to giving it, but also part of the evaluation afterwards, okay? Nausea and vomiting, GI bleeding, these are all adverse effects. So nausea and vomiting are adverse effects, and so this is basically acting cholinergically. So you're going to see nausea and vomiting. Most of our meds have nausea and vomiting as an adverse effect. This one, you absolutely can give with food to prevent nausea and vomiting. Also monitor for weight loss, and I'm going to say that's associated with either nausea, that's really hard to assess in somebody with Alzheimer's, or it's just an overall Alzheimer's thing. It's very tough to tell. Now, GI bleeding is something you really want to watch for. Coffee ground emesis would be indicative of an upper GI bleed. So if somebody throws up and their emesis looks like coffee grounds, that could be an indicator that they are bleeding. Actually, it usually is, unless they've eaten a bunch of coffee. Or dark stools or blood in the stool, but dark stools would indicate an upper GI bleed. Now, because of this risk of GI bleed, we don't give these with NSAIDs. Absolutely, that's a contraindication, okay? So we don't give these with NSAIDs. Okay, we also don't give it to children or those with a history of GI bleed, okay? Over here, you can see one of the adverse effects is that people will have CNS issues, so they'll have insomnia where they won't be able to sleep. And sometimes what they'll do is they'll just give a medication to help them sleep. Dizziness, sometimes that dizziness though is related to the bradycardia. So it's hard to determine, but if they are dizzy, whether it's because of bradycardia or they're just dizzy straight out because of the donepezil, they should sit down or lie down so that they don't fall. And then a headache. And if they have headaches, they should get Tylenol, acetaminophen or Tylenol for the headache, not an NSAID, so not ibuprofen, okay? Specific administration ideas here that are important. Give usually at bedtime with or without food, kind of depending on if they need it or not. And so that rounds up donepezil. Great job, guys.